Hello, we're answering questions on sexual health. I'm joined by Dr. Catherine Hood. Hello, Catherine.
Hello.
Got a question here from a young woman saying, my boyfriend and I recently had unprotected sex while I was on my period. Am I still at risk of becoming pregnant? I think that's a concern to lots of young women who have sex during the time they're bleeding.
Yeah, and I think there's a misconception that you can't get pregnant at that time. The thing is, you can. Yes, it's probably less likely than if you have sex in the middle of your cycle when you're ovulating. But the thing to remember is that particularly when you're younger, sperm can live inside the vagina for 7 days. So although you may be having sex at a time you think is safe, and that it's ages before you ovulate, you know what? Some of those nifty little sperm can still be hanging around. So when you do ovulate, it's possible to get pregnant.
They're ready to take action.
Exactly. So they're ready and primed and in the right place.
So we're back to that old chestnut that unprotected sex always carries a risk.
Yeah, always carries a risk. And I think you get into danger if you start talking about safe times of your cycle or safer times of your cycle. I mean, you have to take it as, particularly if you're young, that at any time, unprotected or without contraception, there is a risk of pregnancy.
I would have thought that those with a cycle that's not so regular are at even greater risk.
Exactly, because the thing is, or with people with a short cycle, because if you've got a very short cycle, then you're likely to ovulate quite close to when your period actually finishes. So, that's more risky. And also, if you've got an irregular cycle, then you have no idea when you're going to be ovulating. So it can be, it can be very dangerous to just rely on, having sex during your period as being, a safe time in terms of pregnancy.
So in this young woman's case, should she be going to the doctor and talking about what she might want to do?
Yeah, get yourself sorted out on a really decent form of contraception. There are lots of different ones available. A lot of women think, oh, it's just the pill and I don't want to take that. That's fine. There are other alternatives to the pill. And in fact, there's a lot of different longer acting forms of contraception that can be even better for younger people, particularly if they're a little bit prone to forgetfulness in terms of taking their contraceptive pill. So, you can have injections, you can have implants, there's lots available. Go and talk to your doctor about it and get something sorted out that's reliable.
Catherine, good advice. Thank you very much indeed. And if you have a similar problem, we hope we might have given you some help. But remember, it's always best to go and see your own doctor for medical advice. Thanks for watching. We'll be back with more health questions and answers.